Dr. Nick Huggins of San Luis Rey Equine Hospital. I'm a board certified equine surgeon. Did my training at University of California, Davis.
I'm Dr. Corinne Potenza of San Luis Rey Equine Hospital.
My areas of interest are elective equine surgery, specifically relating to upper airway surgery, orthopedic surgery, and diagnostic imaging, especially computed tomography.
We tailor to a lot of sport horses and race horses, and some backyard horses as well. We, as young business owners, are always trying to be innovative, and incorporating the BodyTom was one way for us to do that.
We installed and incorporated the BodyTom into our clinic in September of 2015. We found that there was a strong need for computed tomography relating specifically to imaging of the head, neck, and distal extremities. It's been a huge component of our practice since this time.
We had a lot of sports medicine cases that we wanted to be able to CT because we had limitations with other modalities. We wanted to be able to use it for our fractures for pre-surgical planning, and we get a lot of neurologic cases, and we knew that the CT would be able to provide us information on pathologies in the cervical spine that we wouldn't be able to see with our more traditional myelograms and radiographs.
We specifically incorporated the BodyTom system because it is a freely moving gantry. This allowed us to install a computed tomography system into a fairly small workspace without having to modify our facility.
The maneuverability of the BodyTom is exceptional. I can move it myself. It's very easy. We have it in a room where there's 3 different openings, and we can move the CT depending on which anatomical structure we need to scan, whether it's the head or the neck or a distal extremity.
One person can manipulate it. So when it's up on its casters, the radius turn is very small, so it can pivot to swivel around. And then the driving capability when it's down on the tracks also allows great maneuverability within a small space.
We've been very fortunate to be able to utilize the custom radiolucent CT table from STI. It's really helped us with our positioning, especially with the standing head CTs and our distal limb sports medicine cases, positioning them in the CT.
The BodyTom itself is a lead line machine, which allowed us to not have to do any major modifications to the room. It simply charges with basic electrical outlet, and we don't have to have a room that's already lead lined. And the workstation itself has a protective background for the personnel.
The BodyTom has really been very beneficial for this practice with our sports medicine cases. We put a lot of horses' distal extremities through there and have seen a lot of benefits, both for soft tissue and for bone. And we're picking up on things that we're not able to see following our routine lameness exams and blocks, especially after radiographs that we're finding later when we CT the horse.
This will include feet, anything else on the distal extremity, cannon bones, suspensories. We can get up to the carpus, hocks, and in some patients we can do their stifles.
With our distal extremity cases, we like to use arterial contrast to enhance the soft tissue imaging. It really accentuates the lesions for us, especially the acute lesions. But we've been really pleased with the quality of imaging to both the soft tissue structures and the bone surfaces. One of our favorite uses of the CT in our sports medicine practice is the proximal suspensory. It gives us the best of both worlds with the arterial contrast.
Cervical spine, we're one of the first clinics in the world to be able to image the cervical spine successfully all the way from C1 to C7/T1. With the diagnostic imaging being high quality, we can see images all the way back that show us a unique pathology. So we're able to see bone cysts, spinal cord compression, enlargement of the cervical facets, especially if there's a unilateral component. The majority of the cervical spine pathology has already been shown to be in the caudal cervical spine. So being able to uniquely see in 3D back at that level has been a huge push for the clinic, as well as for an advancement for spinal imaging in horses. With our standing head CTs, the skull imaging is extremely high quality, so we're able to see very detailed imaging of the dental structures, the sinuses, and then especially when we have other pathologies such as THO or temporal hyoid osteoarthropathy cases, we're able to uniquely see those types of incidents as well. In addition, we've had some very unique cases where we have either internal ear disease without stylohyoid disease, or in combination and unilateral or bilateral. The ability to see that, or with head trauma, we're able to image those cases. We've also successfully imaged a lot of head trauma cases with basal sphenoid fractures, and we've successfully done those under standing sedation. So even if we have a patient that has suffered head trauma, the majority of them can be imaged under standing sedation without the need for general anesthesia. Performing standing head CTs has allowed us to basically eliminate taking x-rays in our practice of skulls. The procedure takes about 10 to 15 minutes from start to finish. The actual scan itself takes somewhere between 20 and 30 seconds. For the orthopedics, fractures, we're able to see all of the issues immediately before going into surgery. So during preparation, we're able to view where the issue is, if it was more or less than we thought on the x-rays, and it gives us a high degree of confidence going in for fracture repair. Since installing the BodyTom, we use it on average probably 2 to 3 times a week, and since the caseload's grown, we've used it up to 3 to 5 times per week. The breakdown of cases is variable. It's probably about 30% split between orthopedic imaging, cervical spine imaging, and the standing head. The software interface has been very easy to use. It's very easy for everybody to train on. As far as technical staff, it's very user-friendly, and it's simple for the clinicians to learn and simple for the technical staff to learn. The patient input data is very basic. It connects with our PACS software seamlessly. We have the ability to view the images as they're acquired, and then we can do any degree of post-acquisition reconstruction on the images. So the BodyTom software has very good 2D, 3D, and multiplanar reconstruct imaging. So we're able to do that at the time or immediately after acquisition. And then we're able to post-process the images as well if there's a preference prior to sending those to a radiologist or to another PACS viewing software. When they installed the BodyTom, they provided on-site technical training. And during that time, we went through everything from moving the machine, using the software, how it works. They were extremely good to tailoring it to our existing knowledge base. Samsung Neurologica has been very supportive of our unit being installed here at the veterinary facility. The company's support has been phenomenal, so they're able to help us with all technical issues on site and off. They're able to remote log in to our workstation, and then they can do software updates. They can look and do any troubleshooting that is required. In addition, their on-site service has been amazing. Their service technicians have been phenomenal, and their response time is very rapid.
The BodyTom is an expensive piece of equipment for a practice owner. However, we've found that it's allowed us to be innovative and provide higher quality of care to our patients. We're receiving a lot of referrals for this particular diagnostic modality, and it's been able to cover its own expenses, not only from the scans themselves, but for the follow-up procedures.
The expense of the BodyTom is not necessarily justified just by the cost of the scans themselves, but it is easily offset by the procedures that are generated from the diagnostic imaging that we can do, especially with the wide range of diagnostic imaging that it has opened up for us. So it creates a lot of open doors, it generates a lot more work, and allows a higher revenue stream than just the charging for the imaging itself.
We've been really pleased with the caliber and quality of imaging the CT scanner has provided our sports medicine cases.
It has also allowed our practice, basically the level of medicine to increase and allow us to come to a new higher level or standard of care.